Hello, McMaster School of Physical Therapy class of 2020, and thank you for probably welcoming me into your homes, I suppose. And thanks to Dr. Carlesso for the invitation to come and address you and speak to you as part of the course that you're just wrapping up. My name is Dave Walton. I'm an associate professor with the School of Physical Therapy at Western University here in London, Ontario. I've been asked to talk to you a little bit about your opportunities for continuing professional development following graduation and some recommendations based on my 20 years in the profession and some of the work I've done in the area of continuing professional development to help you navigate what can be a very messy field. So, first of all, congratulations on getting this far. This has been just a tremendous achievement for the past couple of years, and frankly, I can't wait to welcome all of you as colleagues to the profession. I am a fiercely proud physiotherapist, and will continue to be. I find this to be a very noble profession, and I'm always just blown away by the altruism, the humility, the knowledge, the skill, the confidence of clinicians, in particular novice clinicians, as they come out of their training programs. So for the next little bit, I guess I'm going to provide you some insights as far as setting your trajectory with regards to continuing professional development. And I'm going to give you my insights from multiple different perspectives as someone who, of course, consumes continuing professional development, as someone who provides continuing professional development, and as someone who researches and mentors other providers of continuing professional development, mostly for physios, but I've had the good fortune of providing CPD to professional groups well outside of the world of physio, and certainly outside of Canada as well. So it's been a very interesting journey for me, to say the least. The first thing I guess we'll get out of the way is that maintaining currency in your knowledge is an important professional obligation. So most provincial colleges, regardless of where you land, are going to require some evidence that you've continued to keep your knowledge up to date. And that sometimes will be called continuing education, continuing professional development. There are different names for it. Continuing quality improvement as well. But at some point, you may be called upon to provide evidence that you have remained up to date on the knowledge, at least within the sort of subsection of the discipline that you've chosen to work. So let's get that out of the way. I will also just say there are many different types of CPD that you could engage in order to show that evidence, that knowledge. It doesn't have to be weekend courses. That's kind of the sort of default that physios seem to go to for CPD is weekend courses, and that for decades has been sort of like a big part of what it is to be a physio, interestingly. Which I say interestingly because that's actually not necessarily the case in a lot of other disciplines. But physios are sort of like chronic course takers, it seems. So I think there's sort of an interesting kind of sub-question to perhaps be asked there. But nonetheless, there are many different ways that you can achieve the evidence that you have kept your knowledge up to date. And while courses are certainly one, reading research articles, engaging in journal clubs, having online conversations, even sort of conversations with clinicians, having mentors in the clinic. These are all different ways that you could demonstrate that you're doing your best to maintain currency in your knowledge. One of the challenges in particular for new clinicians, if you haven't seen it already, you probably have, but you certainly will, is that there is no shortage of continuing professional development opportunities that will come at you for any given week. So if you get the OPA or the CPA newsletters, for example, the emails, you'll see you could take a course every weekend if you wanted to. In fact, you can take multiple courses every weekend. There's no shortage there. And it can be really hard, especially as a novice clinician, to figure out, how do I sort of cut through these weeds here, and how do I figure out the right direction for me? what I hope to do here in the next 20 minutes or so is maybe encourage you to make decisions around those opportunities that go beyond sort of fear of missing out, right? That kind of go beyond, well, I'm going to take this because everyone else is taking it, and so it seems like a really good idea. I like to think we can be a bit more critical in our thinking, and sort of in particular, we can be a little bit more cautious about where we choose to spend our time and money. So one of the first tips I'm going to give here, if you haven't done already, is to create your own strategic plan. And that strat plan should include both a personal vision, which is to say, how will the world be different by virtue of you being in it? That's a big question, actually. That's the sort of grand why question. Why are you here? Why did you choose physio? Why did you get into this program in the first place? Why did you choose to check off that box when you went and applied? And it can be sometimes easy to lose sight of that over the past couple of years, where you've been sort of so laser focused on achieving certain competencies to allow you to pass your degree, that it's probably worth your while to maybe just pause, even right now, pause the video, if you will, and just think back 2.5, 3 years ago, and remind yourself of, why did you choose this path in the first place? What was the difference you wanted to make at that time, and has that changed at all? So setting a little bit of a vision, which is to sort of say, the world will be different, or my community will be different as a result of me being in it in this way. If you have any trouble creating your own vision statement, go and look up some of the vision statements for your favorite brands. I would say, Apple has a very large one, which isn't the best for a vision statement, but there's lots of them out there. Google, Uber, Porsche. Every brand has a vision statement. You can find them on their website. So I would certainly encourage you to look at those and then create your own vision statement. Once you've done that, create your own mission statement. And the mission statement is really more the sort of how. How are you going to achieve your vision? So a vision might be something like, Canadians will move better and function better and achieve their goals as a result of my care. Something like that. So that's a bit of a rough vision, but nonetheless, that sort of fits. And then your mission statement might be, I will, right? And how you're going to sort of help people achieve that vision, or help the world achieve that vision. A third part that people don't always do when setting these plans is to list your personal values, your core values. And this is critically important. I keep a list of my core values as well as my personal vision and mission on my computer, and it has become really important at times. Those times in our lives, and you're all going to reach them, I'm sure you've already gone through several of them, where you come to that fork in the road and you could either go left or you could go right. And it can be hard to make those decisions. But if you have a list of core values, that really helps you in deciding which of the right or left pathway you choose to take. So I'll just give you as a personal example. So I'm 43. I'm here. I've got 2 daughters and my wife, and one of my number one core value is family. It has been ever since my first child, my first daughter, was born. And that has served me very well on a number of occasions. It's allowed me to make those decisions that I would have had a hard time making otherwise. Over here is perhaps, let's say, a promotion or a job or a role that maybe is more money, more responsibility, but that's going to take me away from my family a bit more. So usually I've chosen over here. But that's not, had I not had those laid out, then those would have been difficult decisions to make. So once you get your vision, mission, and values sort of clear and laid out, then you can start to create your sort of personal strat plan. And my recommendation here is to sort of project no more than 5 years. Normally when I have the students here at Western do this activity, I have them do a 3-year plan and a 5-year plan. Life has a tendency to sort of, throw even the best laid plans a little bit off course, especially as you try to project out too far. But 3 and 5 years seems, reasonable. Most of us can kind of get a sense of where we might want to be. And most commonly, the easiest way to do that is through like a SMART goal. And maybe I don't know if you've been SMART goaled to death like our students have, but nonetheless, they actually are valuable. And so sort of in the next 3 years, I want to achieve this and this and this. And you can start to sort of set yourself a bit of a game plan here. It can be really difficult to create a roadmap if you don't know the destination. It's hard to program my GPS and say, take me somewhere. If my GPS will say, where do you want to go? And I don't know, just take me somewhere. It doesn't like that very much. So if you've got that sort of vision in mind and that 3 and 5 year outcome in mind, you can start to kind of create yourself that roadmap, right? You can start to then set milestones or stepping stones along the way. And some of those might be continuing professional development, and some of those might be other things. And these can be your personal strat plan for that. It doesn't have to be professional. If your personal part of your strat plan is home ownership in the next 3 to 5 years, well, then you should probably start thinking about what milestones you need to set in order to get there. Of course, earning an income is going to be an important one of those. So that it all kind of ties together, right? But having that plan and just set it somewhere, because you will need to pull it out. You will need to refer back to it. Again, when you get those emails and you see there's 20 courses coming up over the next month in your area or online, you need to think about, hold on, before I immediately go and register for that, is that going to fit with my plan? It might be a great course, but it might not be the right one or the best one for you to get to where you want to go. So try your best to set some clarity there and where it is you see yourself in the next 3 to 5 years. A couple of sort of key takeaways, just things that I've recognized over the past 2 decades in this field, in this profession. As I mentioned already, first of all, keep in mind that CPD can take many forms. It's not just weekend courses. Again, weekend courses have become almost a bit of like a business unto themselves. There's a whole industry around CPD for healthcare providers, and physios actually, I will say, have traditionally been a cash cow for those. And I know I'll be honest with you, I'm part of that industry. I provide, as I said earlier, CPD, and so that's a way of developing those competencies and keeping your skills sharp, but it's not the only way. And so I would also encourage you to look at other ways that other people are developing their competencies and their skills. And I already named a few of them early on: mentorship, journal clubs, reading books, reading papers, watching YouTube videos, reading blogs, listening to podcasts. There's no shortage of things that you can do. But I guess the second thing I'll also offer, though, is that they're not all created equal. And in a little bit here, I'll talk about some ways that you might be able to sort of critically appraise CPD offerings. And this is something that I don't know about the rest of you in your program, but critical appraisal of CPD has not traditionally been something we focused on, at least in our program at Western, until the past 3 or 4 years ago, when I introduced it as part of our professional consolidation course. And so now, our students leave that course with a sort of a list of things that they can use to appraise any CPD option that might come around. And having that on hand can be quite handy. Another thing, and I just want to make sure that this is clear to all of you. Professional practice, this is an identity that you have all developed. Whether you realize that you've developed an identity as a physio or not over the past 2 or so years, this is not a race. There is no finish line out there. I don't know where, I have no idea where the finish line is. And so, I see these people, especially again, novice clinicians, kind of, it's like they come out of the gate and just sprint to like the first course they can. And in some ways I get it, because you want to get a job. You want to make sure you're marketable. I understand that. And I will fully admit that I understand that there are some clinics that really valorize certain physio skills and competencies, and will say so right in their ads for positions. I will say I've been somewhat vocal against that practice. I don't know that clinic owners and employers recognize the power that they have by doing that in shaping how we, as a collective we, as physios, valorize and prioritize our qualities and competencies, and sort of how that shapes really what it is to be a physio when they say something like, FCAMT required, acupuncture required, something like that. Like that basically means that, 80% of you are probably going to go pursue FCAMT or acupuncture credentialing. And so that clearly is shaping the profession. So I know that those exist, those pressures exist, but I'm going to tell you, and I'll tell you this based on what I've seen over the last 20 years, even despite the current COVID-19 situation we are in, you will find a job. And sometimes, it may not be like the ideal, your forever job, kind of like your first starter house might not be your forever house, but you're going to learn something from it. I promise you that. You will learn something from whatever the job is, wherever you land first, and you will land somewhere. Physio, as far as the health professions go, has one of the highest vacancy rates in Canada. So you're not going to hurt for options for a job. Yeah, it may not be right next to your house, possibly. You might need to be a bit flexible. It might not be exactly in the discipline or the area that you're really interested in. But there will be jobs out there. So the whole argument about I want to make myself marketable, again, I'm going to say I get it. I fully get it. But you are marketable. You have gone through a graduate level university degree program, and you are amongst the elite in terms of medically trained rehabilitation providers. You occupy a really important position in the sort of pantheon of healthcare. And just so don't undervalue the skills that you have coming out of your program. I mean, that's another point that I'm going to make here, is that you already know a lot. You will leave this program with everything you need to be a competent, good physio. I want you to think of that, reflect on that for a second, and recognize that then the CPD that you do afterwards these are really just opportunities for either perhaps you can add a couple of new tools to your already very impressive toolbox. If you feel like you want a couple of new tools, maybe you get bored after a while, you want to try something new. Maybe it's an opportunity to upskill, to create a whole new toolbox. Maybe people have been working in, let's say, ortho rehab for years, and now they want to get into neuro rehab. So maybe they need to go back and they need to upskill, and they need to look for opportunities to develop those skills. More often though, really, it's an opportunity to sharpen the tools you already have. And again, I will say, I take that brand new knife out of the sheath, and that thing is nice and sharp coming out of the factory. You guys are factory new right now. You're sharp. You don't need to go and be sharpened right away. What I would really like to see is that I would encourage you to spend a bit of time consolidating the skills and the competencies that you have learned very quickly. You've had a ton of information pushed at you over the last 2 years. Spend some time working through that, consolidating that, figuring out where you land, what direction you really want to go, and then lay out your CPD trajectories. Another point I want to offer is over the past several years, we've been exploring the concept of what makes a good physio. And we've done this through surveys, through focus groups, through lit reviews. We've done it with conversations both with patients and with providers themselves, with physios themselves. And if you were to even stop and think for one real quick second here, if I was to ask you to think of someone you thought of as a good physio, a particularly good physio, or even just a good clinician, I don't care if it's a physio, it could be your family doctor, your dentist, doesn't matter. And I want you to think about, why did that person come to mind? What is it about that person that made you think of them as a particularly good clinician? And I can tell you, when we do this, and when we do this not just for physios, we do this with any health discipline. I've done this with nurses, with physicians, I've done it with chiropractors, with massage therapists, I've done it with yoga therapists, and I've done it around the world. I can tell you about 15 to 20% of the answers I get are around the technical skills, those instrumental skills. They're, a good diagnostician, maybe they're good with their hands, something like that. They've got good technical knowledge. 80 to 85% of the responses that I get to that question are really more classed in the interpersonal skills category. They're good communicators. They're humble, empathy. They're good at recognizing patterns, right? Sort of just using that intuition. They can connect with people. They demonstrate true curiosity. They're trustworthy, right? So all of these things, when we talk about what makes a good clinician, it's like if you can imagine a pie, right? The upper sort of 15 to 20% triangle are the things that, like, this much of that pie, physios seem to spend an inordinate amount of time trying to develop. And I get it. I mean, clearly we need to be competent and skilled clinicians. I don't think anyone wants an unskilled clinician. So I get that. But what I'm trying to get at is you are skilled clinicians. Right now you're skilled clinicians. But how might we develop perhaps the other 80 to 85% of that pie is a really interesting question. So hopefully then, by now you've started to think about this. Now you're starting to sort of form kind of a vision or a mission in your mind. You're starting to sort of maybe verbalize some of those core values, those things that have driven you in the past. And you've got yourself a bit of a trajectory, a strat plan in mind of a direction you might want to take. And certainly that path probably will include some CPD. So let's assume we've gotten to that point. And now you're looking at maybe courses, workshops, whatever, something that you want to take. You want to go and pay your money and go and listen to someone. So I'm going to offer you now a few just tips when you're trying to work through those. Like I say, there's a multitude of options any given time. So once you've settled there, what I encourage my students to do is to look at these opportunities through a cost-benefit lens. And so you may choose to make your own list of costs and benefits for any given course. In fact, again, that's an exercise that we do in our class as I have the students go and we create our own list of costs and benefits. And then we actually plot them on a graph, a cost-benefit graph, a curve that I've taken from a health economist that I know. And you'll find that all of a sudden, some that sounded really good, the costs seem to far outweigh the benefits when you kind of go and actually stick it on a graph. And then there are other options where the benefits seem to far outweigh the costs. And so you can start to kind of figure out where your threshold is for cost benefit. And so immediately you're going to start to come up with things, and probably already in your own head you've started to think about, costs are fairly easy to come up with for the most part. So those would be things like the tuition or registration fees, your time, and do not undervalue your time. And this is not only your time away from clinic, which also adds to the cost, in fact, in as much as you are unable to earn an income while you're away from clinic. But also your personal time, your time away perhaps from family, your time away from home, your downtime. Okay, so don't undervalue the value of your time. There's travel and accommodation costs, perhaps, if this is something you have to be at in person and it doesn't happen to be right around the corner. Certain courses may come with costs associated with things like books or other materials or equipment. Some of them may require a licensing or a membership fee to be part of a sort of secret society, and those might be one time, or they might be annual and recurring fees. So just think about all of those and sort of start to list those when you're thinking about the costs of a program. Interestingly, the benefits aren't always as obvious. Costs are usually fairly concrete for the most part, but benefits can be a little bit trickier, right? Why do you think this is going to be of value to you? So a few things that we often come up with every year when I have my students go through this. One benefit might be you learn something new, so now you can provide care to a population that you couldn't otherwise have provided care for. So maybe in your community there's a large population of people with, let's say, multiple sclerosis, and that's not your forte, but you're starting to get a few calls of people who are looking for some outpatient physio in the community for MS. Well, then in that case, you might go and intentionally seek out a CPD opportunity to develop that new skill. So that really is the whole sort of either adding a new tool or creating an entirely new toolbox, from the analogy I used before. Other things often start to kind of become, if I'm being perfectly honest, a little bit less exciting, depending on your values. Making yourself more marketable. Let's be honest, some people will pursue CPD for that reason. It might be it's something you need. You want to earn a promotion. You want to earn a higher income. I know there are clinics here in town who for decades have indeed incentivized their clinicians to take certain types of CPD. And once their clinicians get to this level, their fee for service, they get a slightly higher cut. And then once they get to that level, they get again a slightly higher cut. And they get like a bit of a raise, basically. Okay, fine. So obviously the return on investment there becomes obvious if that's the case. But again, I will say I personally don't love that strategy, because what that tells clinicians is that those are the only important CPD offerings to take. Other benefits, I mean, might be learning about new research in a field in which you already work. And so this is that sort of idea of like keeping your tools sharp, right? Keeping yourself up to date. So that can be of value. If that's the primary focus, I mean, I don't think, physio research in Canada, to be perfectly honest, or physio research globally, doesn't move that fast. It moves reasonably quickly, but not so fast that you couldn't update yourself every 2 or 3 years on new evidence. And generally speaking, at least here in Ontario, if you were to be audited by the college, for example, they would expect about every 3 years that you should show some evidence of CPD. So that's a reasonable time frame there. Every year, students will say, well, I would take these courses to improve my patient outcomes, or maybe improve my job satisfaction. And I get that, and certainly that would be something that, if I could be guaranteed that would happen, definitely a good reason for me to choose a course. However, I will say, working in this field, both as a provider, three things: as a provider, as a consumer, and as a researcher, I'll tell you that the evidence to suggest that any CPD offering actually leads to meaningful improvements or changes in patient outcomes is tremendously sparse. Very, very weak. Now, that's not to say that it doesn't. That good CPD may well change your practice and may well lead to better outcomes. It's just that it hasn't really been researched. And when it hasn't been done all that well. So maybe that will happen. But I will, of all the things, of the potential benefits, I will say it's probably the weakest one of them, interestingly, and perhaps a slightly damning commentary on our CPD in Canada. And then, of course, beyond that, so you've got your costs, your benefits, and then there are the other logistic things that I would really encourage you to think about. So things like, who's the instructor? What do you know about that person? What do you know about their teaching style? Does that fit with your preferred learning style? What is the course based on? Is it evidence? Is it theory? Is it the instructor's experience? And I mean, any of those could be of value to you, but just think about which of those would you most value. There are some provinces like Quebec, for example, and Saskatchewan who will have like a vetting process. So has this course been vetted? So in Quebec, you actually need to acquire a certain number of continuing education credits. So is this course going to actually contribute to that? Obviously, that's a reasonable thing to think about. Are there other ways you could acquire this knowledge? That's an interesting thought. You don't have to go and do it through a weekend or a day course. There could be any number of other ways that might even be more efficient, more effective, might be less costly. Or perhaps you decide, no, you know what, I know there's other ways to do it, but this 2-day concentrated, just shoot all the evidence and knowledge at me, that's the way I want to do this, and that's the way I want to acquire that knowledge. Great, if that's your case, if that's what you decide, go for it. And then I guess, what have others said about this course? We don't have a real formal review process for CPD in Canada, so it's kind of hard to find like reviews. You might find them every now and then out on social media or online, but they're sort of, they're a bit difficult to find. So maybe you know people who have taken the course, maybe your mentors, your clinical instructors have recommended it. Again, truth is there's no shortage of CPD, and now that we have more and more online options, we've got Embodia here in Canada, there's MedBridge, there's Evidence in Motion, there's all sorts of platforms out there that you can get your CPD, that maybe the physically going and sitting in a seat and listening to someone isn't even the way you want to go anymore. Totally fine. There are blogs, there's podcasts, there's even social media you could use to develop some evidence, although I urge caution there. The social media, as you probably well know, can be a bit of a toxic place at times, but it can also be a very useful place if you sort of vet the right people and follow the right people. A couple of final notes here, I guess I'll just finish off. First of all, recognize that at least in Canada, CPD continues to be a bit of a Wild West. Like, really anyone can sort of hang a shingle and say, I'm an expert in whatever, ACL injuries in horses, come learn from me. And so really it is a buyer beware system here. So you need to do some of your research. You need to figure out, who is this person? Where are they coming from? What's their experience? What's their knowledge? Is it worth my time to go and listen to them? What I really hope for all of you as we sort of move forward here is that you make your decisions for CPD not based solely on FOMO, on fear of missing out. And I will say that, again, I think I said this earlier, but that's the most common response I get from novice clinicians in particular when I say, why have you chosen to take that course? It's because everyone else is. Well, that can't be the answer for everyone. Not everyone can say because everyone else is. Somewhere, someone had to start this. It may also be because a CI recommended it, and as I said earlier, that could be a very powerful motivator. But again, I would really prefer you to say something like, because it fits with my 3-year strategic plan. That would be a fantastic response to that question. So I really want you to sort of spend some time thinking really hard about, what type of physiotherapy you want to provide, not what everybody else is providing, what you want to provide, and more importantly, who you want to be as a physiotherapist. Okay, so really spend the time. I can't say this enough. This is critical in helping you navigate what's going to become a very messy and chaotic environment going forward. And I guess the final thing I'm going to say, just given the current situation, is that this whole COVID-19 lockdown, I think has in many ways revealed some of the weakness in how, for the past several decades, we as a collective profession have chosen to valorize clinical skills and competencies in physios. Where for a long time we have sort of placed like the manual therapists and maybe dry needlers are kind of climbing up the top here at the top of the physio mountain. And I was an FCANT and I went through that. I've since let my secret Dakota ring expire, but I went through that process. As a profession, we have chosen to really place those kinds of skills at the top of that mountain. But I can tell you that there isn't a top of the mountain. As I said earlier, there's no finish line. You'll go through many of these things and you'll think, okay, as soon as I get through this, well, now I'm going to know what I'm doing. Now I'm going to have really good outcomes with all of my patients. That'll never happen. Some who have heard me talk will have heard me say that nothing works for everyone, but everything will work for someone. And perhaps that's maybe where the value of CPD does come in, is that it gives you a few extra tools you can just shove in your toolbox. But the real skill as a clinician then is deciding what the right treatment for the right patient at the right time is. And that can be really sometimes easy to forget. You'll go and you've taken a course and now you've got this sort of shiny new thing and you really can't wait to try it. And some of you have heard the old saying that when you have a hammer, everything looks like a nail. I would encourage you to sort of pump the brakes and just step back from that a little bit. And now, in a situation where we can't touch people and we can't stick things in or on people, we're realizing that this is exposing weaknesses in the way we have valorized some of these skills. And all of a sudden, the 80 to 85% of that pie that I talked about earlier is becoming even more important. The communication skills, the ability to connect, the ability to motivate behavior change, to recognize patterns when you can't touch things. These are becoming really important. And what I anticipate, one of the effects of this current pandemic is going to be a bit of I'll call it a market correction in economic terms, as far as how we have collectively prioritize our clinical skills and competencies. And so you might be in really good position to be at the front of that wave as we start to sort of say, okay, well, what else could physio be? Yes, we know it's still important to be a good technician. Like, I'm not downplaying that. Clearly, we need to know our stuff. But what else could it be, could go into making a good physio? What else could make you marketable? What else could you choose to develop in yourself? And more importantly, how might you choose to develop those things? Some of them might be courses and workshops. But I will say this, that if you choose to develop some of that 80% of those other skills, you will probably have to look outside the physio bubble for those CPD opportunities. They exist. I can promise you they exist. But there's not many of them sort of within the physio world. So I hope that's helpful. I hope that's given you a little bit of some things to think about as you start to sort of navigate your own path through this brand new forest of physio practice. It's tremendously exciting. Your learning curve, and I'm sure you hate to say this, is going to kind of look like this for the first little bit. You've kind of gone through this period, if I can draw an analogy of sort of being the little chicken developing inside an egg, where you've had this sort of shell of, you know, the university community and your CIs and things like that kind of protecting you. But very soon you're going to hatch, and all of a sudden you're going to be this little chicken out in the real wide world, and you're going to have to decide, you know, how it is that you're going to grow and thrive in a very exciting world, and a very noble helping profession. So hopefully that's helpful, and good luck to all of you. I hope to see you again in a CPA Congress or some other thing down the road. Take care.